Hi everybody, I am Benedetto Giardulli. I am from Italy and I am a physiotherapist and a PhD student in Neurosciences at the University of Genoa. And I'm going to introduce to you my PhD project entitled Development of an External Pelvic Floor Device for Post-Prostatectomy Urinary Incontinence Rehabilitation. My PhD project is divided into different studies and projects. My first study is the literature examination, so I'm going to start with a systematic review. Then I'm going to explore the perception of people who did pelvic floor muscle training. And then I'm going to prove a proof of concept about how to externally monitor pelvic floor muscle contraction. And then we will validate and study the acceptability of this device. Our hypothesis was born studying the pelvic floor muscle contraction in men biomechanics, and we have hypothesized that we can, from the outside, monitor the pelvic floor contraction because there is a muscle called bulbocavernosus that when it's contracted, it provides outward bulging. So we hope that we can monitor this contraction using a pressure sensor. But there are also other limits concerning the use of devices that nowadays are used in pelvic floor muscle contraction because they are invasive, so they use an internal approach that in men is intra-anal. And these devices may act as an obstacle because they prevent the muscles from contracting entirely, or they constitute a barrier to treatment because they can create discomfort in men. So the first study, as I said before, was a systematic review to evaluate the added value of devices to pelvic floor muscle training in post-prostatectomy stress urinary incontinence. And my primary outcome was the PAD test. So we have made this systematic review, including 11 studies. And we have also been able to conduct two different meta-analyses. The first one was in PAD test in 1 hour, and the second one was for the PAD test in 24 hours. Unfortunately, the results of my systematic review says that we cannot conclude whether these devices were helpful or not because the heterogeneity of the studies were too high and because the uncertainty was very low due to the grade assessment. The second study, as I said, was a qualitative study that we have conducted in order to study the perception and experience of people with urinary incontinence performing the pelvic floor muscle training. To do that, we have interviewed 16 participants and we used a semi-structured interview to do that. And we have analyzed the data using reflexive semantic analysis by Brown and Clark. So from the analysis, we have generated 4 different teams. The first team is learn to control the unconscious consciously because participants emphasized how they lost their continence function and they were trying to achieve it again using the active exercises during the pelvic floor muscle training. The second team is starting pelvic floor muscle training, changing mind, because participants emphasized how much this was important for them to change their perspective towards the healing process, because now they felt as they were active and really engaged in this process. The third team generated was into the unknown intimacy because the pelvic floor muscle training for them was something very unknown. They didn't even know that pelvic floor exists. So for them it was very hard to try to understand how to exercise, and this also emphasized the need to be educated on this topic. The fourth team is the importance of not being alone in this process because every participant wanted a guide and they found this guide with the physiotherapist. So they really needed someone who could help them to get their body back. And so they wanted someone who could help them to get their control back. So my next study is going to prove that we can monitor the pelvic floor contraction from the outside using a pressure sensor. So we're going to conduct a proof of concept. We're going to use this pressure sensor connected to a near camera. And we're going to insert this under the perineum of participants, which they are going to be in a seated position. Contemporarily, we're going to use the gold standard to monitor the pelvic floor contraction using an ultrasound image, and we're going to make a correlation between these two events to understand if the increase of pressure during the pelvic floor contraction is correlated and linked to the pelvic floor contraction seen with the ultrasound. So my next studies will also include the study of sexual health, which is a very complex dimension, which can be shaped into different dimensions. The first one is sexual health, as the World Health Organization have defined it. So we're talking about the sexual organs and the transmission and prevention of sexually transmitted diseases. Then we have the sexual pleasure, intended as the personal and very own experience of sexual experiences. Then we have the sexual well-being, which is the cognitive and emotional experience of the sexual experiences. And then we have sexual justice, which is a dimension linked to the social and cultural efforts that the World Organization does to reduce discriminancy, linked to the ethnicity, but also to sexual orientation or the gender. My intention is to study the sexual health with all these dimensions in people with the inflammatory arthritis, because from the literature we know that these symptoms, such as chronic pain, fatigue, stiffness, swollen joints, so all symptoms that people with inflammatory arthritis present, they can affect their sexual health in different meanings, in different dimensions. For example, men can sometimes experience erectile dysfunction, or they can feel like there is less sexual desire or pleasure, or sometimes they can experience they feel like to be less masculine. Or for example, there can be some family planning or different sexual appealing reduction. So all this together can be a very issue in this population. That's why we want to conduct, and we have planned to conduct a study, which is a cross-sectional wave-based study using a questionnaire into Italy, United Kingdom, and Denmark. So we want to study with this questionnaire the sexual dysfunction using a gold standard tool, the International Index of Erectile Function, and the well-being and health, in order to have an image and the prevalence of this phenomenon in different parts of Europe. So the take-home messages of this my PhD project is that we have to promote a proactive and positive approach to sexual health and also to pelvic floor health. We have to emphasize how sexual life is important as a factor in the treatment process, and that the evidence, unfortunately, on this topic are still very limited. With this, I have concluded my presentation, and thank you for listening to me.